Clinician your career. What's your name?
Selena.
Hi Selena. So today we're gonna be performing some low back lumbar tests. The differential diagnosis for this case is S1 radiculopathy, DJD or DDD. We're also gonna be looking to rule out any disc herniation. We cannot know if it's disc herniation only if we got an MRI, but we can suspect it and deal with it even though we don't know, like treating it like if you had it. So first, we're gonna start with inspection. For inspection, so when the patient comes in, we will look for ambulation. That will be if the person can go from point A to point B. We will also look for gait, so that's the quality of how the person is walking. We will look at if there's any motor weakness, and also we will look for minor sign. Minor sign is the ability to go from a seated position to a standing position without pain or just being able to do it. Okay, so now we're gonna do our active range of motion. So can you face that way for me, please? Okay, I'm gonna ask you to touch your toes. Try to touch your toes, and I'm gonna stabilize behind you. Okay, so that's lumbar flexion. Okay, you can come back. That's 25 degrees. Can you do the same to go back? That's lumbar extension, 30 degrees. Can you rotate to this side, your left rotation, 30 degrees, your right rotation, 30 degrees. Can you laterally bend, like having your left arm try to touch your ankle? Okay, that's left lateral bending, 25 degrees, and right lateral bending, 25 degrees, okay? Now we're gonna do bony palpation of the lumbar spine. Can you go facing down for me? So for bony palpation of the lumbar spine, we have the lumbar spinous processes, L1 to L5, or L6 if the patient has another lumbar. We have the PSISs, we have the iliac crest, and we have the sacral tubercles. Now, for the soft tissue palpation, we have the spinalis muscle, the longissimus muscle, and the iliocostalis. Those are the erector spinae. We also have the gluteus medius, gluteus maximus. This might be a little tender, but the sciatic nerve. We're also going to be looking if there's any pain or tenderness in the facets, in the sciatic notch, and the piriformis area. From the hamstring, we got the bicep femoris, semitendinosus, and semimembranosus. Now, can you go face up for me? We're going to be doing some orthopedic tests. So the patient affected side is the right side. That's where the pain is shooting. So for the straight leg raise, we're going to start with the left side. So we do a straight leg raise. Now we go to the affected side. So positives will be radiating pain and or dual posterior tight pain, which will indicate sciatic radiculopathy or tight hamstring. If pain is between 35 and 70 degrees going up, is a possible discogenic sciatic radiculopathy. If pain is after 70 degrees, is tight hamstrings. Now we're going to do buckling sign. So we will go to the affected side of the patient. We will do a straight leg raise, and if the patient has pain, there's going to be a sudden knee flexion that the patient will do to decrease the pain. Positives for that will be radiating pain and or dual posterior tight pain with sudden knee flexion, which will indicate sciatic radiculopathy. This is significant because we're going from nerve, plexus, nerve root, and also cord. And the patient, when they do the knee flexion, that means that their body is telling them that there's pain and they're trying to relieve tension to that spinal cord and that nerve. Now we're gonna do, after buckling sign, is Braggart sign. So we will go to their affected side. Can you say ow? So there's pain here. If the patient says ow, are we gonna be looking at their face too? I will go down 5 degrees and I will do dorsiflexion. If there's pain here, we'll go down, dorsiflexion. So positive will be radiating pain and or dual posterior type pain, which will indicate sciatic radiculopathy. Okay, and the dorsiflexion is important because you want to look if there's a sciatic radiculopathy or is it tight hamstring, and you do the dorsiflexion because the Achilles is not attached to the hamstring. Now we're doing well straight leg. So with this test we will go to the unaffected side. We will raise the leg, and if there's positive is that there's pain on the affected side while I'm raising the unaffected side, and that could indicate a possible disc herniation. If there's no pain here, you can go even more oblique to check. Now our next test is bowstring signs. So I'm gonna raise leg, put it on my shoulder, gonna palpate the popliteal fossa, the bicep femoris, and the semitendinosus. So positives will be pain in the lumbar region, radiating pain, and or dual posterior type pain, which will indicate sciatic radiculopathy or tight hamstring. Now can you sit down facing this wall? Our next test is Kemp test. So can you cross your arms? I'm gonna be stabilizing on your low back. I'm gonna be driving you to your left. So positives will be pain, usually radiating pain, recreating S1 radiculopathy pain. If it's pain away from the side being bent, it's a medial disc protrusion. If the pain is towards the side being bent, that will be a lateral disc protrusion. Another indicator could be local pain. Another positive will be local pain, which will indicate lumbar spasm or facet capsulitis. Now we're going to do an S1 nerve root evaluation. Can you face the camera for me? Okay, so for S1 nerve root evaluation, the disc level is L5. Now we're going to go for some motor tests. So can you point your toes down, hold it there. I'm going to try to bring them up. Don't let me. 2, 3. That's the gastrocnemius and soleus innervated by the tibial nerve. Can you point down, point your toes down and out? Here, up. You push your toes down and try to bring them up. 2. Doing this because if the patient has a S1 radiculopathy, they will feel pain doing this test or weakness. Can you point down and out? And try to bring in and up. Now for hip extension, can you go facing down? If the person if it's in too much pain, I wouldn't let them like go up and seated and then go up again, because that's gonna be creating more pain. But for the purpose of this, we're gonna be doing hip extension. Okay, can you hold there? Bring it down, don't let me. Right. We usually do this for 3 to 5 seconds. Bring it down. I'm gonna bring it down, don't let me. Okay, now can you sit down facing the camera. So this is my reflex hammer. I'm gonna be doing the reflex associated with this test is the Achilles reflex. So you relax your foot. I'm gonna be holding it. I'm gonna palpate the Achilles tendon. And I'm going to hit it with my reflex hammer. Okay. Okay. So that's the Achilles reflex. Now for the sensation. This is my neurological pinwheel. It feels prickly. You give me the back of your hand. Does this feel prickly? Okay. So let's start. You're gonna first start this bilaterally. You're gonna start with L5. So I'm gonna be asking you, can you feel this? And I'm gonna ask you then, if does it feel like this? You're gonna tell me yes or no, or if it's more or less on one side. Okay. So first, do you feel this?
Mm-hmm.
That's L5. Does it feel like this?
Mm-hmm.
Now S1. Posterior leg behind the ankle. Do you feel this?
Mm-hmm.
Does it feel like this?
Yes.
Now for S2, popliteal fossa, anterior of the gastroc. Do you feel this?
Mm-hmm.
Does it feel like this?
Mm-hmm.
Okay. Now let's say the patient feels it more on the right side. We want to know if it's hyperstatic on the right or if it's hypostatic here. To determine that, we will do it unilaterally. Same questions. Do you feel, wait, do you feel this?
Mm-hmm.
Does it feel like this? This is S1.
Mm-hmm.
Do you feel this?
Mm-hmm.
And does it feel like this?
Yes.
Now we will go to the right side. We will start with L5. Do you feel this?
Mm-hmm.
Does it feel like this?
Mm-hmm.
Do you feel this?
Yes.
And does it feel like this?
Yes.
Okay. Okay, so thank you very much, Selena. That concludes our test.